10 exercises every man over 40 should avoid. As the years go by, our bodies change, and with those changes comes the need to train smarter. This doesn't mean stopping your progress or giving up on your goals. It means continuing to move forward within the limits your body allows. That's why today, we'll look at 10 exercises every man over 40 should avoid. These are movements that, despite their popularity, can pose more risks than benefits to your joints, muscles, and tendons as you age. There's no point in giving your best every day only to spend months away from training due to an injury, right? So, stay tuned until the end because number 4 is the most harmful at this age. Number 10, leg press machine. The fixed position and restricted movement pattern of the machine can create disproportionate stress on the knee and hip joints, especially when using heavy loads. Additionally, the angle of the seat often puts the lower back in a vulnerable position, with excessive compression on the intervertebral discs, increasing the risk of lower back pain or worsening existing issues like herniated or bulging discs. Another critical point is that the leg press often allows the use of very heavy loads, which, while seemingly beneficial for strength progression, can lead to muscle imbalances and a lack of movement control. When the load is excessive, there's a tendency to lock the knees during full extension, which can result in serious injuries to the ligaments and joints. Number 9. Traditional crunches. Traditional crunches, performed with repetitive trunk flexion from a lying position, place significant stress on the lower back and neck due to the repetitive flexion and extension movement. This can be harmful for individuals who already experience reduced joint mobility, wear and tear on intervertebral discs, or muscle imbalances common with aging. Moreover, this movement primarily engages superficial abdominal muscles, such as the rectus abdominis, without effectively involving the deep core muscles like the transverse abdominis and internal obliques, which are essential for spinal stability and injury prevention. The pressure on the lower back arises because repetitive flexion compresses the intervertebral discs, potentially worsening or triggering issues like herniated or bulging discs, especially in individuals with pre-existing weaknesses in this area. As for the neck, the pulling motion often performed to lift the torso is frequently done incorrectly, leading to overuse of neck muscles, which can result in tension, pain, or even injuries over time. To replace traditional crunches and work the core more safely and effectively, the plank is an excellent alternative. This isometric exercise activates not only the superficial muscles, but also the deep core muscles, providing a more comprehensive and functional strengthening. The plank reduces pressure on the lower back and neck by keeping the spine in a neutral position while promoting trunk stability. Number 8. Free weight bench press. Although highly effective for developing the chest, shoulders, and triceps, we strongly advise against the free weight bench press due to the associated risks, especially for those training without a spotter. The biggest challenge lies in safely progressing with heavier loads, as a failure during the movement could cause the barbell to fall onto the chest, neck, or face, leading to severe injuries. Additionally, the free weight bench press demands flawless technique to avoid unnecessary strain on the shoulders and spine. The need to stabilize the bar while working with heavy weights can result in muscle imbalances or increase the risk of joint injuries, particularly if there are pre-existing issues in the shoulders or wrists, common concerns as we age. Safer and more effective alternatives include dumbbell bench presses or machine presses. The dumbbell bench press offers a greater range of motion, allowing your arms to lower further during the eccentric phase, which better engages the chest muscles and provides a more comprehensive stimulus. Furthermore, in case of failure, dumbbells can be easily dropped to the sides, reducing the risk of accidents. Machine bench presses, on the other hand, eliminate the need for stabilization, providing complete support throughout the movement. This allows you to focus entirely on the muscular effort without worrying about safety, even when training alone. The machine also maintains a consistent movement path, minimizing the risk of overloading the shoulders and joints. Before we move on, don't forget to subscribe to our channel so you won't miss the best health and fitness tips, and let us know in the comments which city you're watching from. Number 7. Dumbbell fly. This movement requires a wide range of motion with extended arms, increasing tension on the shoulder and elbow joints, areas that often experience natural wear or reduced stability due to aging. For the shoulders, The dumbbell fly puts the joint in a vulnerable position, especially during the eccentric phase of the movement when the dumbbells lower and the arms move away from the body. This positioning can place excessive stress on the rotator cuff, a group of muscles and tendons essential for shoulder stabilization, and may contribute to conditions like impingement syndrome or overuse injuries. As for the elbows, even though the movement seems straightforward, the effort required to keep the arms slightly bent and stabilize the dumbbells throughout the motion can overload the tendons, particularly the elbow extensors. A safer and more effective alternative is the machine fly, which provides better support during the movement. The machine guides the trajectory of the arms, eliminating the need for excessive stabilization by the shoulders and elbows, significantly reducing the risk of injury. Number 6. Push-ups with hands too close together. Push-ups with hands placed very close together, commonly known as diamond push-ups, are often used to target the triceps. However, the narrow position creates a sharper wrist flexion angle, forcing them to bear excessive load throughout the movement. This can lead to joint pain, inflammation, and even chronic injuries such as carpal tunnel syndrome. Additionally, concentrating weight on a smaller area significantly increases tension on the elbows, overloading structures like the triceps tendon. With aging, tendons become less elastic and more prone to micro-tears from repetitive movements, making this exercise even more problematic. If there's a history of wrist or elbow pain or inflammation, the risk of exacerbation is even higher. A safer alternative to work the triceps and chest in a balanced way is the traditional push-up with hands positioned slightly farther apart, just beyond shoulder width. This variation better distributes the load among the chest, triceps, and shoulders, reducing stress on the wrists and elbows. Number 5. Behind-the-head shoulder press with a barbell. The behind-the-head shoulder press is an exercise that requires significant range of motion and a specific shoulder position that does not always align with the natural biomechanics of this joint, especially as we age. After 40, the body undergoes changes, including reduced joint mobility, decreased tendon and ligament elasticity, and often pre-existing injuries or inflammations like tendinitis or bursitis. This combination makes this exercise particularly risky. When performed with the barbell behind the head, the movement forces the shoulders into an exaggerated external rotation combined with elevation. This significantly increases the risk of injuries such as impingement syndrome, especially if there are muscle imbalances or mobility restrictions. To minimize these risks while still effectively working the deltoids, the dumbbell shoulder press is an excellent alternative. This exercise allows for greater freedom of movement, reducing the need for extreme external shoulder rotation. Additionally, dumbbells let you adjust the working angle and trajectory, making the motion more comfortable and safer for individuals with mobility limitations. When performed seated with the back supported by an inclined bench, this exercise offers greater stability and control, reducing the risk of injuries to the shoulders and spine. Number 4. Front raises for shoulders. This exercise places significant strain on the supraspinatus tendon and the shoulder joint, which are already heavily stressed by many daily movements and other strength training exercises, such as bench presses and shoulder presses. The main issue with the front raise is that it often exacerbates an existing muscle imbalance, as the anterior deltoids are already heavily engaged in pushing exercises. This can lead to chronic overuse and conditions like impingement syndrome or shoulder tendinitis. Furthermore, exaggerated ranges of motion during front raises can cause discomfort or even injuries, especially for individuals with reduced mobility or a history of shoulder pain. A more effective and safer alternative is to focus on movements that prioritize the lateral and posterior deltoids, promoting more balanced and symmetrical shoulder development. Exercises such as lateral raises with dumbbells are an excellent option as they isolate the lateral deltoids with minimal risk to the joints. Another variation is the reverse fly, performed with dumbbells, on a machine, or with cables, which targets the posterior deltoids, strengthening the back of the shoulders and improving overall joint stability. Number 3. Deadlift. The deadlift is an incredibly effective exercise for developing total body strength, but it's also one of the most technical and demanding movements, which can make it risky, especially after the age of 40. This exercise requires perfect spinal alignment, total control of the movement, and balanced activation of multiple muscle groups, including the lower back, glutes, hamstrings, lats, and core. Any execution error, such as rounding the back, excessive load, or imbalanced muscle activation, can lead to serious injuries, such as herniated discs, muscle strains, or nerve compressions. Another critical concern is the significant compressive load the deadlift places on the spine. Even with proper execution, this compression can become problematic for individuals with a history of back pain, disc degeneration, or other common lumbar issues associated with aging. Additionally, the joints in the knees, hips, and even wrists can be overburdened, depending on the movement pattern and the use of heavy loads. Number 2. Upright row with a barbell. The position required for this movement increases the risk of compressing the soft tissues around the subacromial space, where crucial structures such as the rotator cuff tendons and the subacromial bursa are located. This type of compression is a primary factor in the development of impingement syndrome and shoulder tendinitis, conditions that can cause chronic pain and limit movement, making not only workouts but also everyday activities difficult. Additionally, the movement often involves moderate to heavy loads, which, combined with internal shoulder rotation, can overload the tendons and stabilizing muscles like the supraspinatus, leading to inflammation or partial tears over time. The risk of rotator cuff tendinitis or biceps long head tendon issues increases significantly, especially in individuals with pre-existing muscle imbalances or reduced mobility, common concerns after 40. A safe and effective alternative to replace the upright row with a barbell is the classic lateral raise with dumbbells, which targets the lateral deltoids. Additionally, exercises like dumbbell shrugs can be included to focus on the trapezius muscles without the risks associated with the traditional upright row. Number 1. Plyometric exercises. Plyometric exercises, known for involving explosive movements such as jumps, dynamic lunges, and bounds, are highly effective for developing power and agility. However, after the age of 40, bone density and impact absorption capacity decrease, increasing the risk of stress fractures or joint overload, particularly with repetitive jumping exercises. Another critical concern is that plyometric exercises require a high level of motor control, muscular strength, and joint stability to be performed safely. Without these qualities, more common in younger or highly trained athletes, the likelihood of execution errors increases, leading to sprains or injuries to the knees, ankles, or even the spine. Even for trained individuals, recovery from these exercises becomes slower with age, which can compromise consistency and progress in training. Now, I have something very important to tell you. Unfortunately, your muscle gains will be minimal if your body has low testosterone levels. The fact is, 77% of men over 40 are still making the same mistakes that lead to decreasing testosterone levels. If you want to learn what these habits are so you can avoid them and maintain high testosterone levels, I'm putting a video on the screen right now. Don't miss it. And may God bless you, my friend.